Mold. Let's talk a little bit about the basics around mold and the problems with mold. There are actually two different forms of problems with it. One is if you get mold inside, things like your sinuses is pretty much the main place. You can end up with chronic sinusitis, chronic sinus congestion problems, postnasal drip. It looks a lot like allergies, but it's not allergies. It's actually mold secreting mucus, or causing the body to secrete mucus in the sinuses, which are the air pockets in the bones of your skull. And this mucus production leads to bacterial overgrowth then on top of it, because the mucus is basically serves as food for the bacteria. So then you might go in with an acute overlaying sinus problem and get put on antibiotics, which we know what happens when you take antibiotics and you have a yeast infection or yeast around. You end up with things like thrush or vaginitis. In the sinuses, you end up with more fungal overgrowth. That's a problem. The other problem with mold is that they release mycotoxins. Mycotoxins are airborne molecules, very tiny molecular structures that you can breathe in from an environmental mold, usually indoors. It pretty much has to be an indoor mold unless you're out like raking moldy leaves or something and you get a big amount of it. Mycotoxins get in the body and they make us feel really sick. They can do damage to a lot of different organs. They can cause immunosuppression. And some people cannot get rid of these mycotoxins once they get in the body. They require things like glutathione intravenously. Most people feel a lot better with that treatment. And then, I guess the third thing would be if you have a chronic fungal sinusitis problem, you've got both going on. You've got the mold itself causing allergy-like symptoms, pain, congestion, postnasal drip. That's all a response to the mold. And then you're also releasing mycotoxins from that mold in the sinuses into the rest of your body, which makes you feel sick. So no matter where you go, it goes with you. So if you go to Arizona thinking, well, I'll go to a really dry climate and I'll feel better, and you don't, that's because you brought it with you. It hasn't gone away. So those are important things I think to think about in terms of mold and treating mold and mycotoxins. And when I learned about the sinus part recently, I was very impressed with that as a treatment. There's a ear, nose, and throat doctor who took his chronic sinusitis patients, and instead of putting them on antibiotics and steroids long term, he went in and cleaned it out, which is a treatment option, surgically, and then he took a sample and sent those samples off to the lab to culture, see what was in there. 97% of chronic sinusitis people had mold growing in their sample. So it's not as uncommon as we may believe. Might be very common, especially for chronic ongoing conditions. Hope that helps you understand. Reach out for with any questions or comments, and we are here to help.